Good evening, all of you. Me, Asif Raza, nursing in charge, Cath lab from Cardiac Center, Bahawalpur. I am very glad to see you all here, and it's a very honorable moment for me to being the part of this conference. Today, I am going to speak on conscious sedation. The theme of my presentation is it should not be a bad memory. First of all, I am going to explain the conscious sedation. A minimally depressed level of consciousness that retain patient ability to maintain airway properly and responds appropriately to verbal command and physical stimulation. Conscious sedation, what is it? Specific goal, the provision of safe analgesia, sedative amnesia during stressful procedure, safely decreasing adverse psychological effect associated with stressful procedure, the return of the patient to their pre-procedure level of functioning. Stages of conscious sedation. There are 3 stages of conscious sedation: minimum stage, moderate stage, and deep stage. But in Cath lab, we are using minimum to moderate sedation until unless in case of any emergency. Level of consciousness sedation. Here we will see the continuum along the level of consciousness. There are 4 levels of consciousness: minimum stage, moderate, deep, and general anesthesia. In this continuum, we will see the patient response in different levels. In minimum sedation level, patient response verbally, airway maintained, and cardiovascular system unaffected. In moderate sedation, patient responds purposefully, may response on light touch, cardiovascular system unaffected. Patient assessment. Patient assessment is very important for going to the conscious sedation. Before the conscious sedation, the physician and practitioner should be need to check the detailed history and physical examination of the patient, use the American Society of Anesthesiology health classes, proper documentation plan of the conscious sedation, and NPO status. Focus history. In focus history, we will see the previous airway management problems, previous interventions, previous therapies, surgeries related to the conscious sedation, aspiration risk, obstructive sleep apnea score, and obesity. Examination and clinical tests. These are very important tests which we need to perform before going to the conscious sedation. Dental status test, Malampati score, mouth opening, thoromental distance, temporomandibular joint mobility, neck mobility, transnasal flexible, endoscopic laryngoscopy. In this picture, we will see the Malampati score. Malampati score used to predict the ease of intubation. There are 4 classes of Malampati score. We will ask the patient to open his or her mouth and see the internal cavity of the patient. And in different classes, in class 1, we will completely visualize the soft palate. In class 2, complete visualization of uvula. And class 3, visualization only the base of uvula. And class 4, soft palate is not visualized. Pre-procedure fasting guideline, minimize the aspiration risk. Clear fruit 2 hour, non-human milk 6 hour, light meal 6 hour. Contraindication. The patient who have the early stages of pregnancy, allergy to the sedative, the patient who having the myasthenia gravis, patient who taking the protease inhibitor for the treatment of HIV, acute angle closure glaucoma. Adverse effect. There are some adverse effect of conscious sedation which last for a few hours after the procedure, which are drowsiness, feeling of sickness, slow reflection, hypotension, headache. Patient monitoring during moderate sedation. These are very important monitoring which we need to assess in Cath lab. Physician should be physically present in the cath lab, elderly, COPD, somnolent, and patient who have the borderline BP. We will start the sedation with minimal dose and then titrate. Patient should have closely monitored with continuously assessment. Monitoring nurse should have no other responsibility. Selection of pharmacological agent. Agent should have anxiolytics, amnesic, and analgesia properties. Commonly used combination of opioids, fentanyl 25 to 50 mics, or nalbuphine 1 to 5 mg, plus benzodiazepam such as midazolam 0.5 to 2 mg. Doses should be selected by the age, body weight, comorbidities like renal, hepatic, pulmonary impairment. These patients required monitor anesthesia care. Monitoring key aspect: level of consciousness, pulmonary ventilation, hemodynamics, oxygen saturation. There should be a balance between the safety and comfort. Cardiac care staff nurse should be trained to manage the sedative emergency. Staff should have knowledge to reversal along their doses like flumazanil and naloxone. BLS and ACLS certification should be up to date. Conclusion: conscious sedation that is carefully planned and carried out by a well-trained healthcare team will allow both caregivers and patients to have a positive, good experience rather than a bad memory. That's why conscious sedation certification is very necessary for all nurses who are working in cath lab. Thank you all of you for your attention.